Hello everyone. Today I am going to talk about health impairments in inclusive education with special focus on ADHD, epilepsy, health needs, accommodations, pedagogical support, management strategies, and inclusive practices. Inclusive education mainly focuses on providing equal learning opportunities to all the students regardless of their physical, mental, emotional, or health condition. In every classroom, there are learners with different abilities and challenges. Some students may have chronic health conditions that affect their concentration, participation, communication, attendance, or academic performance. So, these conditions are mainly called as health impairments. Teachers play a very important role in identifying student needs, creating supportive learning environments, and ensuring that every child receives quality education. Today, I am going to explain the meaning of health impairments, types and characteristics, ADHD and epilepsy in detail, health needs of learners, classroom accommodation, pedagogical support, management strategies, inclusive teaching practice, role of teacher and parents, and challenges and solutions. Now, meaning of the health impairment. A health impairment refers to a physical medical condition that affects students' strength, energy, alertness, attention, or ability to participate effectively in school activities. And these impairments can be temporary, chronic, mild, or severe even. And this may influence certain factors or areas, so like learning, behavior, communication, memory, social interaction, attendance, and academic achievement. And students with health impairments often require medical support, emotional support, educational accommodation, and individualized teaching methods. Now, coming to the definition of OHI. OHI means other health impairment. In special education, the term OHI is used for conditions that limit a child educational performance due to reduced strength, vitality, or alertness. And examples include like ADHD, epilepsy, asthma, diabetes, heart conditions, cancer, sickle cell anemia, chronic illness, and Tourette syndrome. And coming to the characteristics of students with health impairments, normally students with health impairments may show difficulty in concentrating, frequent absence, fatigue or low energy, hyperactivity, anxiety, poor memory, emotional stress, slow academic progress, difficulty in social interaction, behavioral changes, etc. Not all the students have the same symptoms. Each learner is unique in here. Now, coming to the ADHD. So, ADHD stands for Attention Deficit Hyperactivity Disorder. It is normally a neurodevelopmental disorder that can affect our attention, self control, impulse regulation, and activity level. And children with ADHD may find it difficult to sit still or else focus on tasks, follow instruction, complete assignments, organize work, etc. And here ADHD is not caused by laziness or lack of intelligence. Many students with ADHD are highly intelligent and creative. Now, coming to the types of ADHD. So, we had inattentive type, hyperactive impulsive type, and combined type. So, we can talk about inattentive type. Here, the students can mainly struggle with the attention, as the name says, the attention. And symptoms to this are easily distracted, forgetful, daydreaming, difficulty in organizing the task, careless mistakes, and poor listening skills. And coming to the hyperactive impulsive type, it shows that excessive activity and impulse behavior in the students. And the symptoms include constant movement, interrupting others, talking excessively, and difficulty in waiting for our turns, restlessness, etc. Now coming to the combined type. and this include both inattentive and also the hyperactive symptoms and most common form of ADHD. Okay, the symptoms for this are all symptoms of inattentive type, all symptoms of hyperactive, and most prevalent diagnosis and broadest impact on learning. Now, coming to the causes of ADHD. So, the exact causes is not fully known, but possible factors can include like genetic factors, brain development differences, neurological conditions, prenatal exposure to toxins, and premature birth. And here we can see that the ADHD is not caused by the bad parenting. Now, coming to the educational challenges faced by students with ADHD. So, students with ADHD may experience like poor concentration, incomplete homework, difficulty in following the classroom routines, weak time management, impulsive behavior, poor academic performance, and social problems with peers, and these challenges can affect self esteem and also the confidence in oneself. Now, coming to the health needs of students with ADHD. So, students with ADHD need structured classroom environment, consistent routine, clear instruction, emotional support, positive reinforcement, behavioral guidance, motivate movement breaks, and counseling support. Here, some students may require medical treatment prescribed by the doctors. Now, coming to the classroom accommodations for ADHD. So, here accommodations can changes and that made to help student learn effectively. So, important accommodations include seating arrangement. So, sit student near the teacher or keep away from the distractions. Next, short instruction. Give simple and clear instructions or break task into smaller steps. Next, extra time. Provide additional time for assessment and test. Next is visual support. Use charts, diagrams, and reminders. Now, coming to the movement breaks, allow short breaks to reduce restlessness. Now, next one is organizational help. Here, we can use the planners and checklist in this. Next, positive reinforcement. We have seen like giving the good behavior or else pricing for a good behavior and also for the effort. Now, coming for the pedagogical support for ADHD. So, pedagogy refers to teaching methods, right, which are used to support learning. And the effective pedagogical practices include activity based learning. So, here it is mainly on hands on activities, which increases the attention and participation in students. Okay, and next one is multi-sensory teaching. It uses mainly or like visual aids, audio materials, demonstration, and interactive methods. Now coming to the cooperative learning. Here, cooperative learning means group activities can improve the social interaction skills. Next, differentiated instruction. Teach according to the individual learning styles and abilities. Now, next one is technology integration. So, educational apps and digital tools improve the engagement in the certain things. Next, frequent feedback, like giving the positive feedback instead of like scolding or something, can motivate the students or else increase their confidence. And constructive feedback helps the students. Now, management strategies for ADHD. So, the teachers can manage ADHD effectively through behavior management, like setting the classroom rules clearly and maintaining the consistency and rewarding, like giving rewards to the positive behavior. And next, time management support them, like we can use the timers and also like creative daily schedules. Now coming to the emotional support so like self confidence should be encouraged, should not be demotivated, and avoid humiliation or punishment. so that it can affect the students' confidence in daily life. Next, parent collaboration. So the teachers and parents should communicate regularly and give the review of the like students regular activities. Next we had IEP, which is individualized educational plan. So some students may need personalized educational planning in this. Now, the second one is epilepsy. We have talked about ADHD till now. The second one is epilepsy. So here we can say that epilepsy means it is a neurological disorder that causes repeated seizures due to abnormal electrical activity in the brain. And we can say that repeated seizures. Okay, so this seizures can affect the movement, awareness, sensation, behavior, and consciousness. Here we can see that epilepsy is not a mental illness or else something like contagious disease. So many students with epilepsy can perform academically well and with the proper full support. Now, coming to the type of seizures. So, we had generalized and focal. So, coming to the generalized seizures, this affect the whole brain. Okay, entire brain can be affected, and the symptoms can include loss of consciousness and body shaking, frequently, and muscle stiffness. So, these are the symptoms for generalized. And now, coming to the focal. So here focal means only one certain part of the brain can be affected in the case of focal. And the symptoms can include like confusion in certain things or else some strange sensation like this is going to happen likewise and repetitive movements. Okay, these are the symptoms. Next, the causes for this epilepsy can be possibly it can be the brain injury or else genetic factors, infections or else lack of oxygen at the birth that can be also a cause, and neurological disorder. And sometimes the exact cause is unknown. Okay, we cannot say based on this certain categories. And next one is educational challenges faced by students with epilepsy. Okay, so in the case of educational and also the health needs. So if we see in the case of educational, so the students with epilepsy can or can experience or else may experience this fear and anxiety, frequent absences, memory problems, fatigue after seizures or else difficulty concentrating, and social stigma and isolation due to misunderstanding. So they prefer to be alone likewise. And some students feel like isolated due to misunderstanding from the peers. Now coming to the health needs of students with epilepsy. So here student with epilepsy need this medical supervision, safe classroom environment, emotional security, stress reduction, and advocate rest, emergency support during seizures. And teachers must know the students' medical history and also scissors action plan. That is mandatory to every teacher to know about the children's every kind of things. Now, coming to the classroom accommodation for epilepsy. So, there are certain safety measures. So, we can remove some dangerous objects nearby and ensure safety seating arrangement. Next, we have flexible attendance. So, allow support for the missed classes and support for missed assignments. Instead of schooling, we can just support the students. And next, we had extra academic support. So, providing notes for after having seizures, and also often revision can help and catch up the sessions. Next one is a stress-free environment. So it avoid like excessive pressure and reduce anxiety triggers in classroom. Next we had emergency preparedness. Like teachers should know what to do during a seizure and when to seek medical help. So they should know completely about this ADHD or else epilepsy or else this seizures. So teachers should be aware of all this certain basic healthy needs. Okay. Next, first aid during a seizure. So the teacher should first mainly do like not having a tension or else in a hurry mode. So the teacher should stay calm, protect the child from the injury, and move harmful objects from away, and turn child gently into one side and loosen like tight clothing, and also time the scissor. Next, what the teacher should not do, like put anything in the mouth or else forcefully holding the children or panic that are not being considered. Like if any medical is required, we can call in certain situation, like if seizures last for more than 5 minutes, or else if there is an breathing difficulty, or else repeated seizures occurs, we can go with the medical help, or else we can call to the ambulance. Next, coming to the pedagogical support for epilepsy. Here we can see the inclusive teaching methods. So, like we can see the flexible teaching approaches, a repetition and revision of missed content, and use of visual learning materials. And next one is emotional encouragement. Means the students should feel accepted and respected, and they should create a safe and welcoming environment and celebrate the progress and their achievements. Next, peer awareness. Like educating classmates reduce this stigma or else reducing bullying or misunderstanding, and promote the inclusive class culture. Okay, and then individual support. Teachers should monitor academic progress regularly, and also provide personalized assistance after seizures. Okay, and then we had inclusive strategies for health impairments. So in inclusive education means normally all students learn together in the same classroom with equal opportunities. There is no discrimination in the inclusive classroom. Everyone is same. And here importance include like student centered teaching. It mainly focuses on individual needs and also abilities of each learner. So next one is UDL, which means universal design for learning. So it has multiple ways of learning, participation, and expression. And the third one is flexible assessment. So which include like oral test, projects, assignments, and alternative evaluation methods. Next, collaborative learning. So this encourages the teamwork and can also understand the other perspective and be support in all the activities. Next, we had this positive classroom climate. So, like we have to create a classroom based on respect, acceptance, and empathy. Next, we had assistive technology. So, using of digital tools for support learning and communication is very much accepted. Next, role of teachers, parents, and school administration. So we can see the responsibilities of teachers in inclusive education, which include identifying the learning difficulties, provide accommodation, create inclusive classroom, communicate with parents, support emotional well-being, encourage participation, and reduce discrimination. Next, a caring teacher can greatly improve a student's improvement with the confidence and also the success. Now coming to the role of parents. So the parents should share every single medical information with the school, not hiding any single aspect, and support learning at home and attend school meetings so that the child behavior or else academic progress can be known easily, and encourage the student or else the child emotionally and work together with teachers. So here parent teacher cooperation is very much essential. Now, coming to the school administration, the school should provide certain things like inclusive policies, counseling services, health support, teacher training, barrier free environment, and emergency medical facilities. Next, challenges in inclusive education for health impairments and also some of the solution. So the challenge we can move on to the challenges first. So first one is lack of awareness. So many people misunderstand between this ADHD and epilepsy. And second one is stigma and discrimination. So people with ADHD or epilepsy may feel bullying or else feel isolated or else may feel bias in the classroom. Next, limited resources. Some schools lack trained teachers and support services and large classroom. So the teacher may find the individual attention that is very much difficult. Now coming to the emotional stress, the students may develop anxiety and social or else low esteem in the classroom. So those are the challenges. Now coming to the solutions for each of this. The first one we can do the teacher training. So there should be an like inclusive education methods in the classroom. And for the second one, like awareness of the programs. Like school should educate both the students as well as the parents. And next, counseling services. So giving the psychological support and that should be available every time or else whole academic year. Now, there should be a government support, like policies and funding or inclusive practices. Next, collaboration, like having a conversation with teacher, parents, doctors, and counselors can work together. Now we had the importance of inclusive education. So inclusive education promotes equality, builds confidence, and reduces discrimination, encourages social interaction, and also improves academic participation and develops empathy among students. So here every child has the right to education and dignity. Okay. In the conclusion, I would like to conclude with a few points that health impairments such as like ADHD and epilepsy can affect a student learning, behavior, and emotional well-being and classroom participation. So, however, with proper accommodation and supportive teaching methods and inclusive practices, the students with health impairments can achieve academic success and lead confident lives. So the teacher must understand that inclusion is not simply placing students in classroom. It is about creating environments where every learner feels safe, respected, valued, and also supported. And inclusive classroom is a place where differences are accepted and every student gets an equal opportunity to learn and grow. Therefore, awareness, empathy, collaboration, and effective pedagogy are essential for inclusive education. Thank you.